Okay, we'll get started. Thank you everyone for joining. We're very excited to host Christen this evening for her session, Practical Play and Impactful Imagination. I would like to start off by paying respect to the land upon which we have the privilege to work, learn, and play. Obliquity respectfully acknowledges that we are located on Treaty 6 territory, a traditional gathering place for diverse Indigenous people, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, and Inuit. Our programming is influenced by a need to address issues such as racism, intercultural competency, trauma-informed care, and human rights early in medical training. Our sessions and initiatives, such as our medical student planner, have been used as calls to action for self-directed learning and relearning. To introduce Christen this evening, she is a registered social worker with a Master's of Social Work specializing in human service management and leadership. As a health promoter at Access Alliance, she uses arts-based practices to improve health outcomes for newcomer populations in Toronto. She coordinates the Hubs of Expressive Arts for Life, or HEAL project, a community-based research initiative supporting newcomer women survivors of domestic violence. She believes that arts are a health behavior and advocates for artists to be a part of the interprofessional healthcare team. Christen is actively involved in several working groups and advisory committees focused on addressing gender-based violence and newcomer health. And I'll hand it over to you, Christen.
Great. Thank you, everyone. I just want to check my audio. You're able to hear me clearly? Okay, wonderful. I see some nods. All right, so welcome this evening from Toronto. And yeah, today I'll be sharing about practical play and impactful imagination. As you're listening, maybe as a little introduction, you could just put your name in the chat and your favorite playful activity that you like. So everyone can kind of see what type of play we like to engage in. Okay. So as you're typing your name, introducing yourself and your playful activity, this is kind of what our time together is going to look like. I'm going to be sharing another land acknowledgement and a small little parable about going upstream. And then I have these kind of three little vignettes that I would love to share about newcomers and using the integration of arts. And then lastly, if we have time, we can do a little bit of sharing, feedback, and gratitude. As you're also listening to the introduction, if you need to I have small prompts throughout the presentation. So if you want to grab a little notebook or a writing utensil or use your computer, feel free to grab that at this moment. Okay. So in Toronto, I would like to acknowledge that we are on the traditional territories of many Indigenous nations, including the Huron-Wendat, the Anishinaabe, the Haudenosaunee, and the Mississaugas of the Credit. I am also coming from a community health organization that predominantly serves newcomer populations. So as we support marginalized immigrants and refugees, many of whom are settlers or have experienced forced displacement, I want to emphasize our shared responsibility, solidarity, and the importance of learning and relationship building. I also want to share a personal story about a lady named Mary Ann Caviosi, and she guides annual water walking. And so the image that you see on the screen is from the Grand River in Ontario. And every single year, she guides community members by scooping up a bucket full of water from the Grand River into a ceremonial copper pail. And then she proceeds to walk along the Grand River, as roads allow, over 200 kilometers until it empties into Lake Erie at Port Maitland. And this process takes about 4 to 5 days. And these water walkers are normally taught by Anishinaabe women. They bring teachings about being responsible and caring for the water because they are the ones who create life. Water walkers also sing for the water. They pray for the water and they protect it along the journey. And as they walk, they offer positive energy, love, and kindness into the water, recognizing it as a living being. And why this is so important is because water is not just water. water is also life. So why I'm sharing this story is because we're going to return to the water and the river in just a moment. Okay. So I'll let you gaze upon this image of newcomer um, participants that are waving these beautiful silk collective flags. And I'm just going to share a little bit about my positionality because I think context of who we are really make a difference to why we share the information that we do. So I started out in community arts. I worked for a very small organization that animated parks as an approach to welcome newcomers to the city. And so I spent a lot of time in public spaces using the arts, many different things like silk painting, all the way to poetry and music and movement, to welcome people into spaces that maybe were not utilized, and also welcoming people to find a sense of belonging and connection. From the community arts approach, I ended up finding myself in South Africa working for a very small art agency using psychosocial support. And the agency, I love the name, and it was called Sinomlando Center, which is in Zulu, it means we have a history. What this told me is that trauma healing and our story has much to do with our histories and the ways that we tell it and understand it. That was also when I met my first social worker working in a hospital there. And upon my return back to Toronto, it sparked a new career in pursuing social work. So I ended up receiving my social work master's and finding myself at Access Alliance. So, for those who are unfamiliar, Access Alliance is a community health center in Toronto that serves newcomers, that includes immigrants, refugees, asylum seekers, and we really focus on health equity. We are one of actually the few organizations that support, free healthcare for newcomers who are waiting to apply for OHIP. And on the screen, one of my favorite unique parts about the agency is that we have a research department, which means that we're constantly collecting data and using data to really inform our practice. And as we know, newcomer populations are very transient and um, their population changes all the time. And so using data really keeps us up to date with the changing populations and their needs. Something else is, being at this agency, my title is actually a health promoter. And so even though I'm trained as a social worker, I am able to work at the, very micro level, implementing group therapy sessions all the way to really informing public policy around newcomer health. And so that's what I will be sharing a little bit more today. Okay, our first video. Fear not, if you do not hear audio, that is okay. We are merely going to gaze upon this hopefully calm and soothing river while I share a parable about going upstream. If you know about this parable, sit back and listen in. And if you have never heard of it, also sit back and listen in. Okay, so the parable goes like this. Imagine standing by a fast moving river, much like the one that you're looking at right now. And then all of a sudden, you hear someone drowning. So you jump in, pull them to shore, and save them. But then another person falls in and another. And soon you're exhausted, constantly reacting, trying to save people downstream. Finally, you decide to go upstream and discover the real problem: broken bridges. Some are strong and safe, but others are weak and unstable. The people falling into the river aren't there because of personal failure or circumstance. They're there because the system around them is unsafe. And this is the powerful way to understand public health. In public health, we often focus downstream, responding to treating illnesses, providing emergency care, and supporting people after harm has already occurred. And these responses are critical for sure, but they don't address the root cause. And so when we think about newcomers, refugees, and migrants, those broken bridges can include systematic barriers like language barriers, limited access to culturally tailored healthcare, unstable housing, precarious employment, and discrimination. And so these conditions increase the risk of poor health, not because of individual choice, but because the structural realities really produce these outcomes. And so a public health approach asks us to go upstream, to focus on prevention, This means improving access to services, addressing things like social determinants of health, and creating equitable systems that support people before they reach the crisis. So primary prevention and health promotion is huge. It's not easy and it takes time. But by fixing, these bridges upstream while helping those who are downstream, we can really create a healthier, more just communities and health equity for everyone. So this upstream parable has stayed with me for a very long time. And every single day I think about, where do I situate myself on this stream? And so I'm now going to enter into three little vignettes that I encounter in my everyday work. And I hope that it sparks some sort of, curiosity or thinking around newcomer health or the work that you do. Okay. So I want to ask, what if your healthcare and settlement team included an artist? What if you were admitted to a hospital and received care only from physicians? No nurses, no care coordinators, no social workers, no administrative staff, not even pharmacists or discharge navigators. Would all of your healthcare needs and concerns be met? And what kind of care experience would that create? In practice, good practice, it is rare for a patient to be supported by one healthcare profession. I think many of us in this room believe and really support interprofessional team-based care. And this, has been established for a very, very long time, bringing together professionals with different expertise, addressing the many physical, emotional, social aspects of a person's health. And so when we think about this, I want to bring into the question of arts and artists. Do you encounter artists or art-based facilitators in your everyday life as healthcare professions? So I started to do a little bit of digging and I asked myself, in what ways is arts already being integrated? So you can see some examples on the screen. Since 2002, the Arts for Healing Foundation has installed more than 14,000 artworks in hundreds of healthcare institutions across Canada to really inspire and animate spaces of hope. The RX Art pairs leading contemporary artists with pediatric hospitals to really humanize again the environments that they're in. The next one, Artwork for Cancer, places donated art in cancer centers, contributing to compassionate environments. And if you're in Toronto and you've been to UHN, University Health Network, you can observe an array of visual arts or hear musical tunes from musicians playing in the atrium. And the more I dig deeper, the more I actually found that many of these initiatives position artists as adjacent to healthcare teams rather than formally employed for long-term staff or part of the interprofessional team. For the most part, I found that a lot of the collaboration was very informal and episodic. It's very program-based, which means that it's time limited, not standardized, and contributes to what I perceive as very fragmented care. And so it begs the question, right? What do we understand about artists and how do we actually want to integrate them? So I did a little bit more digging and I found a really great example at the University of Alberta, and they have something called Artists on the Board. Maybe some of you have already heard, but I think it's an incredible example of how they hire artists as staff. They support also volunteers. So this is capacity building to provide one-on-one bedside support, group programming, and it is really showing and building evidence for the therapeutic value of bringing the arts. Patients have reported reduced pain, improved well-being, self-confidence, and elevated mood. So art is not merely just on the walls or a form of entertainment in the atrium. They're actually part of the care treatment for patients. So when I look at, this community health center that I'm a part of, I also want to share with you the arts model of care that we came up with. And I love this model because it really flips mental health support for newcomers upside down. So a lot of times primary health care will, once they start seeing complex mental health symptoms, they will refer newcomer clients to one-on-one mental health care. Oftentimes, newcomer populations, there's a lot of fear, judgment, discrimination on seeing a one-on-one counselor. There's also not a lot of information or culturally tailored one-on-one support. And so what this diagram is showing is actually starting with an open group therapy approach, that instead of going straight to one-on-one support, they come to open group support. So I'm going to actually go through each of these sections here to dive a little bit deeper of what we mean by this. So we start getting comfortable. We understand that when you come from many different parts of the world, mental health is also not used as a word that is very normal sometimes. And sometimes there's not even words for certain mental health in a person's language. And so we started to do different things. In the first image, we started to do art-based mental health mini activities in the clinic waiting room. We know that waiting rooms are often very stressful. They're points of anxiety. And honestly, you have many pamphlets with so much information, it's quite overwhelming. And so we started to do art-based wellness, little pop-up workshops, we call them. In this way, people are able to self-regulate while they're waiting for their doctor's appointment. And it also exposes them to non-threatening ways of understanding what mental health and well-being is all about. Another thing which is very hot topic these days is social prescribing. We understand that settlement and healthcare centers are not the only place to support our mental health. And so we do monthly gatherings at museums and galleries and community arts events. And again, another way of attracting newcomer populations that may be scared of entering into a healthcare facility. And in the middle, we also have open group community arts weekly sessions. This is another way of not only building capacity within the arts, but also finding new ways of self-regulation and co-regulation. And so this section is about getting comfortable. What we often find is that as people get a little bit more familiar with the work that we're doing, they start asking questions. What is self-regulation? Why do I need to do that? Why do I feel like I'm more calmer and my stress is actually decreasing? Well, we say, why don't you get more? Oh, this is actually supposed to say, um, I think it's supposed to say getting, knowing more. So, knowing more, then we invite them to newcomer well-being sessions. We've basically animated social work mental health sessions on setting boundaries, grief and loss, trauma in the body. And we do closed group sessions with participants, and they get a certificate after 6 to 8 sessions. And this is a little bit more of your psychoeducation. What's really great is by the time people finish our newcomer well-being programs, they actually don't need to see a one-on-one counselor. We've actually done a kind of group assessment on folks, and they have what they need to actually continue on their healthcare journey. But then, of course, you have those with kind of more complex mental health needs. And so they actually graduate to something called diving deeper. This is where we do our one-on-one referrals. And at this point, instead of being fearful to see a one-on-one counselor, they're already exposed to so many of the things and they're ready now to see a one-on-one counselor. What you also see here is sustainability. And so those folks who may not go on to one-on-one counseling, they actually want to be leaders in their community. And so they go through an onboarding volunteer process where they become art assistants and they go right back to the beginning, getting comfortable to support other community members wanting to learn more. And so what this tells us is that firstly, it is very successful, and we've seen more and more participants engaging in mental health support. On average, for our newcomer well-being programs, we have 20 to 25 people coming to every session, which to me is quite incredible for a very transient population. So I'm going to just close off this section with a video. Again, you won't be hearing the audio, but you can observe while I share. So what if you were admitted to a hospital and received care from an artist as part of your care team? You might be invited into bilateral drawing to support mobility, reflective writing to shape an illness narrative, or embodied gesture to awaken unfamiliar muscles. You might find yourself humming along to musical tones that gently ease anxiety. You might even meet a new friend at a collective poetry workshop or discover a creative medium that surprises you. And perhaps all of this might allow you to see yourself unexpectedly as an artist. Would all of your healthcare needs and concerns be met? And what kind of care experience would you create? So let's pause. And this is where you're going to take out your documentation props. And the prompt is write one or two sentences with I am learning, and you can finish the sentence, and I am reflecting on. So I'm just going to pause for 1 or 2 minutes for everyone to jot down some thoughts from this little vignette that I just shared. Yes, take a sip of tea. I see you, Sue, with your lovely cup of tea. All right. So if you're still writing, please continue to write, but I'm going to move on to our next little vignette. Okay. So the next one is called Beyond Attachment, the role of community artists in newcomer primary healthcare. So I'm sure most of you, maybe in Ontario, have learned about the Ontario Primary Care Action Plan. And this was set last year, and it has very robust and ambitious goals. And some of the goals are connecting every Ontarian to primary healthcare by 2029. That means they want to expand and create new primary care teams to attach almost more than 2 million people to care. This is a huge, massive investment of $3.4 billion to grow capacity in workforce and services. And really, the goal here is to reduce and eliminate wait lists and improve timely access. Other types of goals as well is to strengthen, again, what we talked about, team-based interdisciplinary care models across communities, and really to build and expand primary care workforce. So attachment to primary care provider is an important first step. But when I think about what does it mean to attach someone, for many populations, including newcomers, this may not be sufficient, and I'm going to share why. So let's take a look again, reminding ourselves of the social determinants of health. These are non-medical factors that have major influence on our health. Things like social economic factors, the way we live, healthy behaviors, income, status, gender, all of those things play a part in our health. And so when we think about upstream prevention, we actually need to be looking at all these factors, not just the physical factors of those folks who come to see primary health care. I recently read a study in 2022 on virtual care, and it estimated that a patient visits community health centers approximately 5 to 6 times per year, and physicians 2 to 4 times per year. To me, that is not a lot of times. And when you think about newcomer populations, health is a part of a myriad of needs and navigation challenges. And I have there on the screen, there's actually a quite famous clinic at Women's College called Crossroads Clinic. And a social worker there said, for many refugees, accessing healthcare may be just one among many competing priorities for settlement, such as finding a house, a job, childcare, and more. So these limited touch points and competing priorities raise an important question. Does this level of contact meaningfully support trust and long-term engagement with care? And so this brings me back to my community art days when we saw consistently community members coming out to engage. And community artists are very skillful in animating not only spaces, but communities by inviting people to connect. We transitioned from the arts world and we noticed that already things like play and imagination and creativity are under-recognized roles in the primary healthcare sector in terms of connecting and building that therapeutic value. And so when we really think about healthcare reflecting patient identities, experiences, and values, what does it mean then to have more than a couple times of touch points at a healthcare or settlement agency? So I'm going to share some beautiful photos. This is a photo from our Singing Together program where we host weekly community singing. We don't use any lyrics, but it's all a cappella. And this group has been meeting for 6 months and more. And we are seeing similar people come back and also bring their friends. And it's part of when they come to their doctor's appointment or see other types of specialists. Another program that we did was with newcomer youth. This is a shadow puppetry workshop that we talked about belonging and different identities and the light in our lives and also the shadows in our life. And again, this was adjacent to the care that they were receiving in their primary healthcare journey. And here we see community members outside painting with natural pigments. One thing I will add here, why this is so pivotal is because many community members kept asking me, Christen, can you just sneak me some paints? Can you sneak me some art supplies? They're too expensive, even at the dollar store. And I told them, I am sorry, I cannot give you that. However, let's find a solution together. And serendipity just happened, and we met a newcomer community artist named Mercy, who actually taught us how to make pigments from everyday herbs in your kitchen. So things like turmeric and mint and um, all the other herbs that you have. We learned how to make pigments, and that's what we actually ended up painting here in this collective mural. And again, it was part of their coming to their their appointments to the health center. Yes, persimmons. Thank you, Catherine. And so when you think about, again, first points of contact are so important. They are truly the gateways to other healthcare services and referrals. Low tech, high touch engagements is what we call it, helps newcomers feel more comfortable, confident, and at home. And so it's not just these first points of contact, it's continuous points of contact, may I add, this ongoing relationship. And so when I went back to the Ontario Primary Care Action Plan, I read the definition of attachment, and it says the goal is to provide documented ongoing relationship with a family doctor, nurse practitioner, or team. Ongoing relationship, what does that mean to us, and how can we fully do that? I think that artists are part of that ongoing sustainability with our patients. And so I'm going to take another pause here, take out your writing utensil or your form of documentation, and finish the sentence. I am learning or I am reflecting on. So we'll take a moment here. All right, I see some folks probably done. Okay, if you are writing, continue to write. I'm going to move on to our final little vignette. Okay, the next one is Art is Health Infrastructure, Rethinking Gender-Based Violence Responses for Newcomer Women. So I cannot have, a conversation about healthcare without talking about COVID-19. COVID-19, as we know, revealed so many stark disparities among our healthcare system, especially among our newcomer population. And one of those is called the shadow of the pandemic. And this really referred to gender-based violence increase not only within our own country, but globally. There have been many reports, and I'm sure maybe some of you also during COVID and even after COVID have heard so many shelters being over capacity, so many people trapped in their own homes and not able to access many supports. For newcomer populations, they experience much more than that. Things like, again, language, system distrust, discrimination, limited understanding of Canadian rights, and access to culturally tailored resources and services. We also know that many things are fragmented. And so when newcomers are wanting to seek help, they have to jump many different organizations and tell their traumatic story over and over again. And this is just not going to work. And so Access Alliance 4 years ago received funding from the Public Health Agency of Canada to prevent and help address family violence. We received a 4-year funding to look at how expressive arts can be an intervention. And so over the past 4 years, we developed a 12-session intervention using expressive arts as the foundation. This image that you see on the screen is from our Bengali speaking group, and they're using dance ribbons to understand somatic resourcing, attuning themselves back into their bodies. And across these 12 sessions, not only did we, talk about psychoeducation, trauma in the body, but we also had guest speakers to talk about healthy relationships, human rights, empowerment, self-defense. And we saw and observed that using the arts actually helped people to retain information, but also to self-regulate as they were talking about really complex and also very taboo topics. And so I will put in the chat a link later on more to this project because there's so much more. But all to say is that as we were leading this project, one of our expressive arts therapists introduced us to this idea called nest building, building a nest together. And this happened at the beginning of every single session. Everyone brought and collected many different nature items. They brought little artful items. And as you can see on the left-hand side, there's not really a nest going on. It's quite empty. And the facilitator put a rubber duck in the middle and said, let's build a nest together. We put on some outdoor music, and all the women spent 20 to 30 minutes building a nest for this bird using the items that they had in their environment. At the end of this activity, we asked them, tell us, how does this represent trust, safety, and belonging? Why did you choose to put that item to build this nest? And then the women discussed, they talked about why this bird had this beautiful nest. And that was our way of establishing group guidelines. As a practitioner, I observed, and in my mind, I was like, oh, this is a perfect example for a metaphor about systems thinking. That truly, when we think about not only gender-based domestic violence, every health issue, we need this mentality about building a nest together because each one of us has a different type of resource that we can bring. And so we created, these two diagrams, just to illustrate what it looks like building a nest together at a systems level. So on the left-hand side, these were all the different groups that contributed to um, to this project. People like our Team at Access Alliance, participants, peer researchers that we've trained, practitioners across many different fields, advisory committee members, immigrant insight scholars. All to say is that we are needing, expert advice and also lived experiences from many people to understand the complexities of certain social issues. On the right-hand side, we have sectors. So the intersecting sectors for this project were really, healthcare, mental health, community-based research, settlement, domestic violence, and expressive arts. For a lot of healthcare and settlement agencies, they may not be familiar with connecting and working with the arts. And so that's something that we did a lot of was building capacity. How do we understand artists as part of the team? And how do we even hire artists? What are the questions that we ask because they're so different than hiring a nurse or, a social worker or a dietitian? And so something else that we realized too was we started to imagine. I have here on the screen imagination as a public health, it should say public health framework, but really recognizing that arts engagement is a health behavior and it requires a structural commitment, not just at the ground level. And so in this image, I love this image because the pigeon has a really sad cold egg because it has only a couple of sticks and twigs and no shade to the pigeon, but this is not a comfortable, safe nest. And so on the right-hand side, you see an abundant, colorful, creative, imaginative nest. And this is the way that I think we should imagine our systems of thinking for healthcare. And it brings the question too, what is the role of imagination? It's not just an extra, again, adjacent thing, but it's actually foundational to the ways that we want to approach certain healthcare issues. I love this quote, and it says, artists and art may be the most important healthcare workers of our time. They help us think differently and they build community value differently. And this is from a really amazing national project called Arts for Everybody in America. And again, you can look them up, but they really advocate for the value that artists really are the foundation to as healthcare workers. And so, we're going to take another pause um, for this final vignette and complete the sentence. I am learning and I am reflecting. Okay. So as you're finishing up the final kind of pause and reflection, I'm just going to show one more kind of collage image. Okay, so we have returned back to the riverbank and back to the river. And now we see many different images. And these images were taken from the three vignettes, but really to showcase this idea of along the riverbank, downstream and upstream, we have many things happening. And so as you're reflecting on, your own practice, I mean, I'm sure there's many diverse practitioners in this room. Think about, where do you position yourself on the stream? Where would you like to go on the stream? Um, so we can just take a pause here as you look at this kind of collage on screen. And I will add here, there's a really beautiful expressive arts activity called the River of Life. And for those who have done it, it's really a reflection on your life, and you kind of plot pivotal moments in your life on the stream or river. And I just continue to love this analogy of using a river to actually understand so much of, not only our identities, but this systems thinking. So we are perfectly on time because we still have some time for some sharing. So before we kind of do some sharing, just look over those prompts that you wrote down during the presentation. I am learning and I am reflecting on. And if you need to finish any of those sentences, you can do that now. And what I'm going to do is I'm going to stop sharing my screen so that we can all see each other. And if you would like to, show your video, that would be amazing. And we're just going to open up the floor to whoever would like to share a couple of sentences from the prompts that they have shared. And if you are not wanting to necessarily share in the bigger group out loud, feel free to pop some sentences in the chat. But I think it would be really beautiful to hear some of the learnings and reflections. So I'm just going to pause for a sec and open it up to the floor. And you can go ahead and unmute. No need to raise your virtual hand. Yes, go ahead, Sue. I see you unmuting.
Um, I said, I am learning to open up my mind as to who is a health professional. And I'm reflecting on how to infuse the arts into my own workshops and my own patient advocacy work.
Thank you.
Yeah, hi, I'd like to share if you can hear me.
Yes, we can. Go ahead.
Yeah, I'm learning how to empower myself and my allies, and I'm learning how to think beyond the box for art in communities and thinking of a way to integrating arts in our lives without thinking it as an instrument. Thank you.
Yeah, thank you. Thank you so much for that.
I'm on the periphery of this. I teach newcomers English, or yeah, they're mostly French speaking. And I'm thinking of how to put the arts into that.
Thank you, Catherine.
I've been thinking a little bit about the programs that you run and a desire to see those in action here in Edmonton, where I am, and also um, where I was and where I want to be in the river.
Yes, thank you. Thank you. Okay. Hey, thank you. Thank you for those who shared and those who partook in reflecting on some of these small little stories. So before we end off, I would like to share a resource with you because we love resources, and it sounds like some of you in your reflections do want to learn more about integrating the arts. And so I'm going to go back to sharing mode. Okay. Are you able to see my screen? Yes, wonderful. Okay. So what you're seeing here is a new website that actually launched this year called Access Alliance Arts for Family Health. It's a many multiple year project, and really it was our way of honoring the arts over the last 2 decades that we've been implementing Access Alliance as a resource hub. And so when you're on the site, which actually let me put it in the chat for you so that you can save it on your browser. You'll come to the home. Oh, let me go to the home page. You'll come to the home page. And this just explains a little bit about arts integration, specifically within healthcare, community health services, as well as settlement. So it is very helpful for those who are, teaching English to newcomers. And so on the first page, you have a bunch of different highlighted resources and things like what's happening. When you go to the About page, you can scroll down and read a little bit more about the purpose of this. And really, it's to advocate and build capacity within practitioners to let them know that you don't need to necessarily identify as a professional artist, that we are all artists and we are able to facilitate at varying capacities art integration. When you scroll down, the little promo video that I shared in the presentation is also here as well. If you are wanting to learn more about the HEAL project, we also have a landing page for that. This shares a little bit more about the HEAL project. Why I bring this up is because we were only two to three out of 12 projects that were federally funded that were art-based. And so we see also a trend in federally funded projects towards the arts realm. And so the more that we build evidence, the more the government of Canada can continue to see that art-based practice is actually applicable, across the country and for large scale health, promotion to address. Specifically, this one was addressing family violence, but you also even see IRCC, our immigration federal sector, invest in more art-based approaches. So reading through the project can also give you ideas on if you are thinking about applying for funding. This is a project that was funded and it was very successful. Okay, for the next tab, this is one of my favorite sections, and it's called the Resource Hub. It acts very similar to, a library search engine. And so right here, you have the type of audience. You can identify as a researcher or an academic, a manager or leader, or a practitioner. Then when you go to the content types, we've basically taken all of our art-based tools and research and resources, and we've divided them into, I believe, 9 different categories. And so, for example, I'm going to actually share activity guides because someone kind of asked about that. How do you integrate, art? And so our activity guides are ready to go art-based sessions. So let's say you want to, integrate, talk about better boundaries. You can click on the resource and it comes to a landing page, which gives you the type of audience, participant benefits, recommendations, and the best part is downloadable items. So when you download this item, it actually gives you the whole session right there for you. What's also really great is that we have handouts and also activities. So this is a really great way, again, if you also want to get familiar with integrating activities for newcomer populations and non-newcomer populations, the activity guides are the way to go. Another section I would say too is that if you're looking to build evidence within your agency, we've also have a research paper section. So those are some, highlighted research papers that we love, and toolkits and handbooks, resources, facilitator training. So all to say, I won't go through all of them now, but please take your time and explore this section. The next section I want to share about is stories and articles. This is our way of sharing some of the work that we've been doing. So some of the little vignette stories are seen in the article area. So we talk about prescribing arts and culture, artists as part of the interprofessional team. We also share a little bit about our programs, what we've done for programming to give you some ideas. So for example, we did a whole summer weaving program. So this just talks about it. And then lastly, how to connect with us. But the point is that, this resource is really for you and it's available and free for you to use. So I just wanted to share that with you. Okay. So with the remaining time that we have left, maybe I'll just open it up to questions and comments. I will put up the post-workshop feedback because I think Obliquity would be very, very thankful if you filled this out. So as you're filling this out, if you also want to share a comment or feedback or anything that resonated with you tonight, I'm going to let that space be for, the next couple of minutes before 8 o'clock. So thank you so much for listening and taking your time this evening to be here. Thank you. Okay, and I'm gonna also take a look at the chat as well. Yes, thank you. Okay, so Hei Ying has shared, drawing on your work and the work of Access Lines, could you share your own approach or understanding of what culturally safe or tailored means? I explore culturally tailored approaches through art-based research with newcomers and just curious to hear different perspectives. Totally. I think this is very expansive. In terms of safe, we often look at trauma-informed principles, right? Allowing people to have choice, ensuring safety is there. Something that we do is also making sure that one or two healthcare professions, specifically mental health, is available during our expressive arts programming so that if someone needs more one-on-one support, there's actually time and space for that person to be referred to that practitioner. We also make sure that in terms of culturally tailoring art programs, we ask communities, what are traditional art forms within your culture? And so we try to let them lead art modalities that speak to them. Because we know that newcomer populations actually come from so many cultures where art is actually is very naturally integrated. And so we ask them, for their suggestions or advice. We often do environmental scans as well to see evidence-based, out there, not only locally, but internationally, what has been done previously. We also make sure that we have different levels of art activities. So a lot of times we actually find that using clay and plasticine, some folks really do not like the tactileness of that. And so we provide, latex gloves, for example. So we are constantly recognizing that art is also not for everyone. And even though we love the arts, we're not also there to pressure anyone to use the arts for healing. And so we're very transparent about that as well. Yeah, and I think through the website too, we even have guides on how we do, trauma-informed expressive arts. But those are just some there. Sue says, I write and share stories about healthcare experiences, and I often get dismissed by healthcare leaders as being too soft. Yes. How do you overcome the arts versus science mentality that is often present in healthcare settings? 100%. I feel like a lot of my job is actually advocating and showing evidence, partially why we have that stories and articles section, because we do the research. We have time to do the research because I'm actually part of the research and evaluation department. And totally, people also have the association that arts is for children. And it's not. We know that it is for a person's lifespan. And so it's constantly bringing actually scientific evidence so that we can say this is actually scientifically backed. A couple of resources I would look into is the Jameel Arts and Health Lab. They're an international, really amazing research and arts center. And the other one is called Neuro Arts. So both of them I would check out, and they have a wealth of evidence-based scientific knowledge on the arts. And so for sure, one thing that we also try to do is that we do art workshops for practitioners because we know art is experiential. And once they experience it, they almost forget about the scientific part and they're like, I love this. And so the more that you can engage people in just doing instead of cognitive engagement, the buy-in is very, very quick. So I would say those two things. And I'll just write the two resources. So the Jameel Arts and Health Lab is a huge one, as well as the Neuro Arts. And one more thing that is very pivotal is UCL, University College London, has lots of arts research coming out of there. And the UK, I would say, has very great examples of hospitals who have actual art departments. So they're actually quite progressive. Canada's a little behind, but we're getting there. But the UK definitely is one of those places to look into. Yes. Okay. Thank you. Yeah, thank you for those comments and questions. And yes, we do not think it's too soft. It is serious business. 100%. Yes. Actually, I love doing healthcare practitioner engagement because that was another thing too I noticed in settlement agencies is that settlement staff are newcomers themselves. And so they experience almost the exact same symptoms as participants. And so if we're not taking care of our healthcare workers, how can we possibly take care of the communities that we serve? And so actually a lot of the programming that we do is trying to engage practitioners in various capacities. Yeah. Hmm. Yeah, speaking about soft, there's also another movement in Toronto called soft cities. You can look it up, but it's really, mitigating that idea of urbanism is so hard. And I think healthcare is also the same way. So how can we actually produce more gentle, compassionate environments called soft cities? Yeah. Yeah. I will also put my work email in the chat. So if you are wanting to talk more about arts integration in the agencies or the work that you do, I'm so happy to hop on a call with anyone here. We do consultation calls, and I can also lead you more in-depthly through the website if that is also helpful as well. Okay, I'm going to stop sharing my screen here. Yeah, but it is really encouraging, I have to say. One of the greatest supports was actually finding allies at the agency who already believed in the arts. I think sometimes it's a lot of effort and a lot of time to convince people who don't believe in the arts. But if you build like a little uh, team, like a team, that can also help as well with advocacy. Yeah. Yes, thank you. Thank you. Thank you so much, everyone, for listening. I mean, there's so much more to say, but I think the little vignettes and the river analogy really have stuck with me. So I thought I would share that today. Yeah. Yeah, thank you. Yeah, and if you ever also want to talk about the differences between licensed art-based facilitators versus community artists or artists, that's also really interesting. Um, Kind of systems thinking of how to hire different types of artists within the agency. What does that mean? And what type of the services do they provide? That's often a question that agencies often ask us.